I know it's important to take care of my mental health, but it's not always sure where to start. Where are some ways or ideas do you have for to take care of your mental health right now?
One of the positives that have come out of this is the conversation about mental health is one that we're all having. And hopefully some of the stigma around mental health is sort of getting chipped away. But the negative is that most of us and many of us are experiencing pretty serious mental health challenges. And that you want to do something or people want to do something about their mental health again. Step one, great step, because now we can do something. And what to do, I do want to sort of make a distinction here between there's things we can do, we'll call it under the category of wellness, right? That we all should be doing to help reduce our likelihood of having mental health challenges or make it easier when we do face some really serious mental health concerns. So like on the wellness side, we all should be figuring out what are things that make us feel good, like all the people baking bread or whatever it is during pandemic, like what are the things that make us feel good? And there's the basics, right? You want to eat well, sleep well, get sunlight, get your vitamin D, especially in Chicago, like whatever you could do to sneak that in. All of that is and we think it doesn't make a difference, but it makes a huge difference. So that's one, whatever we can do to get that in there. Social connections to whatever level you want, especially within our autism community, that's so variable, right, about how much they want, but that finding at what level is important to you, whether it's in who it's with that you're good with, even if it's online, that social connection, as long as it's not toxic, really important. And then the other pieces are sort of, again, on the wellness side, right? Things that make us feel good, giving and doing volunteer work or finding ways to help others. Actually, we know giving helps the giver more than the recipient in terms of mental health. So that's a really sort of important thing, a way that we can start to improve our wellness and our just general standard of sort of well-being. And then the other piece is a little more sort of tricky, but it's kind of getting into stories and doing the things that get you connected with people. Maybe it's not social connection, but reading or, listening to other people's stories, whether it's, radio or TikTok or whatever it is, like really hearing other people's stories of the way they're living in the types of communities or experiences that you're going through. That's a big deal too. And then on the mental health side, and then I want to talk, that's more on the clinical side, right? If you are feeling that you are facing challenges or anxiety or mood challenges that are beyond sort of this area of just doing the little things in your day-to-day, it's not just, but it's hard doing that, then that's something I would really strongly recommend. It's easier said than done given the access in our community. That's what requires clinical support. Calling for a therapist, calling for support groups, calling your doctor, if you have a primary care or pediatrician, is the first step. That's what we have to start with, is getting clinical care.